Implanting AI chips in your mind could cause you to lose yourself, says scientist. The tiny processors will connect to your brain via tiny threads significantly thinner than a human hair, about 4 to 6 mm in width. These sensors will fit on the surface of your skull and then relay information to a wearable computer that sits behind your ear, called the link. With this all in place, your brain can then connect to your iPhone via an app. We are truly living in the future and it's terrifying. Musk isn't the only person radicalizing the future of our brains. For example, Ray Kurzweil, the futurist and director of engineering at Google, said he expects that by 2045, ultimately making us immortal.
Ultimately, we can do a full brain-machine interface, meaning that we can, ultimately, yeah, this is going to sound pretty weird, but achieve a sort of symbiosis with artificial intelligence. So, but this is not a mandatory thing. This is a thing that you can choose to have if you want. And this is something I think that's going to be really important at a civilization level scale. So, and I've said a lot about AI over the years, but I think even in a benign AI scenario, we will be left behind. And so, and hopefully it is a benign scenario, but I think with a high bandwidth brain-machine interface, I think we can actually go along for the ride. And we can effectively have the option of merging with AI. I think this is extremely important. And if you think about your limbic system and your cortex, your limbic system is kind of your primal needs and wants, and it's like where a lot of your emotions are coming from. And then the cortex is like the thinking, planning part of your brain. And I haven't met anyone who wants to get rid of either the cortex or the limbic system. So clearly they work together well. Even though your cortex is, in principle, far smarter than your limbic system, everybody wants to keep the limbic system and their cortex. So hopefully we can have a tertiary layer, which is the kind of a digital superintelligence layer. And in fact, you already have this layer. So it's your phone and your laptop. And the constraint is just how well you interface, the input and output speed. So the output speed is especially slow since most people are typing with thumbs these days. So you have a very slow output speed. Your input speed is much faster due to vision. But the thing that will ultimately constrain our ability to be symbiotic with AI is bandwidth. So in the limit, after solving a bunch of brain-related diseases, there is the existential, it's mitigation of the existential threat of AI, or, yeah, this is the point of it. So creating a well-aligned future, that's the idea.
Composed of nearly 100 billion cells called neurons. Neurons come in many complex shapes, but generally they have a dendritic arbor, a cell body called a soma, and an axon. The neurons of your brain connect to form a large network through axon-dendrite junctions called synapses. At these connection points, neurons communicate with each other using chemical signals called neurotransmitters. Neurotransmitters are released from the end of an axon in response to an electrical spike called an action potential. When a cell receives enough of the right kind of neurotransmitter input, a chain reaction is triggered that causes an action potential to fire, and the neuron to in turn relay messages to its own downstream synapses. action potentials produce an electric field that spreads from the neuron and can be detected by placing electrodes nearby, allowing recording of the information represented by a neuron.
Well, I think like a lot of people in the audience, there's a wide range of knowledge about neurons. I mean, some people view the brain as like this incredibly mystical thing that you cannot interface with the brain, and then some people are aware of deep brain stimulation, such as occurs for Parkinson's patients. So try to address the broad range of understanding. I mean, neurons, essentially, like, there's that whole idea, what if we were just a brain in a vat? This is often posed by philosophers, except we are a brain in a vat, and that vat is our skull. Everything that you perceive, feel, hear, think, it's all action potentials. It's all it's neural spikes. And it feels so real. It feels very real. But these are all impulses from neurons, what's called a spike. And our goal is to record from and stimulate spikes in neurons and do so in a way that is orders of magnitude more than anything that's been done to date, and safe and good enough that you can, it's not like a major operation. It's sort of equivalent to sort of a LASIK type of thing. So where you can sort of sit down, machine does this thing, and you can walk away within a few hours. And that's it. And you're not even in a hospital. So, like there's basically, in terms of key points that are worth taking away, the system that we designed in version 1 is capable of on the order of 10,000 electrodes. So each chip, which is 4 by 4 millimeters, is capable of 1,000 electrodes, or has 1,000 electrodes. And we think doing up to 10 is feasible. So this is in contrast to the best FDA-approved system, which is like a Parkinson's deep brain stimulation thing, which would have on the order of 10 electrodes. So the system, even in version 1 that we're going to unveil today, is capable of 1,000 times more electrodes than the best system out there, and they're all read and write. So this is really quite, I mean, for something to be 1,000 times more than what is publicly approved is quite a big difference. And this will get better with subsequent versions. Now this slide may seem a little generic, because like everything's got robots, electronics, and algorithms at this point, but not threads. So the I feel like I'm in Transcendence. Actually, I was in Transcendence. So there's very tiny threads that are about a tenth, roughly, of the cross-sectional area of a human hair. So they're extremely tiny threads. In fact, the threads that we have, like I said, even in version 1, are about the same size as a neuron. So if you're going to go stick something in your brain, you want it to not be giant, you want it to be tiny. And to be approximately on par with the things that are already there, the neurons. So this is about the size of a neuron, each thread. And then you really need this to be done with a robot, because it's very tiny and it needs to be very precise. So you don't want to pierce a blood vessel. So when so each thread, the robot looks sort of basically through a microscope and inserts each electrode specifically, bypassing any vasculature, any kind of like blood vessel, and making sure that it can be inserted without causing trauma or minimal trauma. Yeah, it's not zero, but you won't notice it. That's the important part. You won't yeah, you won't feel a thing. Yeah, anyways, obviously algorithms. So just to give you a sense of scale, this is how tiny the threads are. That is not even a big finger, that is a small finger. So these threads are just like I said, way smaller than a hair, and there's 1,000 of them. And this is what the robot looks like. It's sort of quite a complex device, but it all comes down to a very tiny point. So we want to just like you see the robot on the left, and then the what looks like the needles for insertion next to a penny, but in fact the actual needle that gets inserted is way tinier. It's that little tiny thing at where the arrow is pointing. That's actually the size of the needle. It's about 24 microns in diameter. Extremely small. It's so small you can't really even see it in the picture with the penny. And then this is your rain on uranium. No, that's not really. That's agar. So you can get a sense for the robot doing the electrode insertion. That's a very zoomed in view. So they're all very tiny, and the robot is very selectively applying them very delicately. And then this is what the chip looks like. So action potentials. So each one of those represents one electrode. So there would be up to 10,000 of these lines. Yeah. So. I guess, it's always difficult to say. There's going to be there's a lot more in this presentation. So in terms of things that I think are important to bear in mind, this I think has a very good purpose, which is to cure important diseases, and ultimately to help secure humanity's future as a civilization relative to AI. The threads are very tiny, and there's a lot of them, and they're very carefully placed. And the operation on a per chip basis, it involves just a 2 millimeter incision, which is dilated to 8 millimeters, and then the chip is placed through that, and then it goes back to being 2 millimeters, and you can basically glue it shut. You don't even need a stitch. So, and then the interface to the chip is wireless. So you have no wires poking out of your head. Very important. So it's basically Bluetooths to your phone. Because we'll have to watch the App Store updates for that one. Make sure we don't have a driver issue. Updating. But the key is this is something that is going to be not stressful. Our goal is not stressful to put in. Should work well, hopefully. We'll check it out very carefully before it becomes obviously FDA approved. And it's wireless. So this I think has tremendous potential, and we hope to have this aspirationally in a human patient before the end of next year. So this is not far. A lot more there's a lot more really smart people. So what you're seeing here is the outcome of a lot of hard work by the Neuralink team. And yeah, I think there's some pretty impressive stuff. So we can take some more questions from the audience. The lights are bright, so you might have to gesticulate or something.
Yeah. Is there a roadmap towards allowing people or organizations to actually push custom code to these devices?
This is a really interesting question. So it's definitely too early to really think about this. Elon, I don't.
I think we'll hold up on the custom code immediately. Yeah. But I think it's conceivably there could be some kind of app store thing in the future, or some sort of platform with like a very rigorous verification of the application. Yeah, but yeah, I think that this is certainly not meant to be sort of a closed system. Ultimately, if we can enable others to contribute, whether they're at Neuralink or not, that would be a good thing, for sure.
And just to add one more thing to this, we've had some discussions, like it might be that if you want to build an app or a business on top of a brain-enabled API, then your business model can't be advertising, for example. It's very important to us that this is that this turns out well for everyone, and so there's thinking like that going on.
Yeah. Sure.
Does the brain's neuroplasticity make this harder or easier for you guys? Like, are you trying to interpret a continually moving target, or is there a chance for a symbiosis once the brain realizes what's happening to it?
Yeah, there's no doubt that plasticity will make things. So the question was whether neuroplasticity will help or hurt our effort, and I think there's no doubt that it will help. First of all, there's just the fact that you have to learn how to use these devices. But for example, in work that we did in my lab earlier, we showed that you can write in information that isn't perfect. It doesn't get that map perfect. Or even it can be somewhat quite different from the map. But ultimately, you can learn to use that through plasticity. And there's going to be a lot of learning required, and the ability of the brain to adapt to new information, and in particular, the ability of the brain to take information that comes from multiple sources and merge it in an effective way is, I think, the kind of thing that really will facilitate complex new tasks with these devices.
I mean, it stands to reason that the neurons are responding to electrical pulses. So the electrode is providing electrical pulses, to the neuron, an electrical pulse is a neuron. It just thinks it's a neuron, and it's going to, for sure, adapt dynamically because it just sees electrical pulses, and it's going to respond to those. Yeah. So, yeah.
So there's no advertising.
I mean, Jesus. I mean, you'd have really no escape. We cannot do that. That would be an ethical barrier. So the question is, if this will not be advertising driven, which I think would be unwise, then how will it be paid for, essentially? Is that correct? Or how will we ensure that it's broadly available? Yeah. I think that the cost of these brain disease or brain injuries is extremely high to society. If you have to take care of somebody, or if they need comprehensive medical care or hospice, this is actually very, very costly to society. So I think the economics of solving for that make a ton of sense. And if you enable somebody to work and be productive, contribute to the economy, I think that will. I think that the economics of that will easily pay for itself. And then, in the limit, of course, if you want to be symbiotic with AI, it'd be like, I think it's safe to say you could repay the loan with superhuman intelligence. I think it's a safe bet. So I think the economics of this will work out. And the first order is really just to make sure that it works and works safely. And then I think it'll really be the option of the person. But it is critical that this be sort of, as we've talked about before, like a LASIK-like device. If if this has to be done by a neurosurgeon, it cannot be scaled. There just aren't enough neurosurgeons. So it must be, just as one wouldn't want sort of like a hand operated laser for an ophthalmology situation. You really want the robot doing it with precision. The same thing goes for the brain interface. So, yeah. Sure. Yeah, so the question is, have we implanted the chip in animals? And if so, what are the results? So I think first it's important to say that we regard any chip implant, even if it's in a rat, as a very serious thing. Like, so we even care about rats, even though they have the Black Plague and everything, So like they arguably have some karmic payback. But nonetheless, we care about rats. And then we're extremely sensitive with monkeys, and we work with the University of California at Davis for any of the monkey activity. So, and the results have been very positive. Do you want to maybe talk about? I know this is a sensitive subject.
Yeah.
But I think it is. Yeah. We definitely need to address the elephant in the room, the monkey in the room.
Yeah, I mean, I think that we wish that we didn't have to work with animals, right? That we just wish that wasn't like a step in the process, but it is. It's a very important part in the research and development process to produce better outcomes for human patients and improvements in human health. And we try to be very thoughtful and we follow the 3 R's of like reduction, replacement, and refinement of laboratory animal medicine, and we try to be very careful and thoughtful about it and do it as efficiently as possible, because we believe that the benefit to humanity is in the end like the benefits outweigh the negatives.
The questioner also asked about the results, and there is a paper available, I think now, soon, that has some of the results in them.
Yeah, I mean, but we have made a monkey has been able to control the computer with its brain. Just yeah.
Google's new brain implant will learn anything for you using AI. Google is in the development stages of a neurochip. Nikolaos Kyrinos, founder and CEO of Foundtech AI, has been working to personalize education by enabling anyone to learn almost anything using artificial intelligence. Any queries will be answered immediately by an AI implant. It will communicate with chips installed into our brains. We won't even have to type or write down anything. All we will need is some thinking and we will get the answers beamed straight into our heads.